Did you know doctors can often spot serious health problems before you even say a word, just by noticing how you take care of yourself? That's right. Your hygiene habits might be quietly waving red flags without you even realizing it. If you're in your 70s or 80s, there are 7 personal hygiene mistakes doctors often catch right away. And mistake number 4, it's not only incredibly common, it's also surprisingly dangerous. It might just make you want to rethink your entire routine. Now don't worry, this isn't about being perfect. It's about being aware. These small oversights, the things we do without a second thought, can actually be early signs of much deeper health issues. Problems that can quietly chip away at your energy, your independence, and your quality of life. In this video, I'll walk you through all 7 mistakes, share the story of Harold, a retired engineer who almost missed his own warning signs, and show you the simple changes that can make a big difference. If you're ready to take control of your health and age on your own terms, tap that like button, subscribe, and let's take this journey together, because your golden years should truly be golden. Mistake 1, neglecting oral hygiene. When was the last time you really looked at your toothbrush? Not just a glance while rushing through your morning routine, but really looked. Is it frayed? Worn down? Are the bristles soft or flattened? It's easy to overlook. We've been brushing since we were kids. It's automatic. But in your 70s and 80s, that automatic routine might need a second look. Because here's the truth. Dental care isn't just about fresh breath or saving a few teeth. It's about protecting your life. Most people don't realize that poor oral hygiene is strongly linked to serious health risks. Heart disease, stroke, even dementia. And this isn't theory. It's science. Geriatric experts at Harvard Medical School have found that untreated gum disease allows bacteria in your mouth to enter your bloodstream. Once that happens, it can cause inflammation in your blood vessels, triggering conditions that may become life-threatening. In fact, seniors with poor dental health are up to 3 times more likely to develop cardiovascular issues compared to those who brush and floss regularly. Let me tell you about Sylvia. She's a retired school teacher from Oregon. She spent her life educating children, raising her family, and staying active in her community. But like many of us, she thought bleeding gums were just a normal part of aging. It didn't hurt, just felt annoying, so she ignored it. No big deal, right? That is, until her doctor found inflammation in her heart valves during a routine checkup. The culprit? Oral bacteria from untreated gum disease. Sylvia was lucky. Her cardiologist told her that if she'd waited just a few more months, the damage could have been irreversible. That moment changed the way she saw her toothbrush forever. Here's the thing most people don't realize. The body whispers before it starts screaming. Bleeding gums, swelling, bad breath. These aren't just minor annoyances, they're warning signs. And for older adults like us, ignoring those signs can cost more than a tooth. It can cost us our strength, our independence, or worse. So what can you do right now? First, go check your toothbrush. If it's older than 3 months or looks worn out, replace it. Not tomorrow, not next week, today. And consider switching to an electric toothbrush. According to research from the University of Pennsylvania Dental School, electric toothbrushes remove up to 62% more plaque than manual ones. That's not a small difference. It can mean the difference between keeping your gums healthy and letting bacteria slip into your bloodstream. Brush your teeth twice a day, not for just a few rushed seconds, but for a full 2 minutes each time. Set a timer if you need to. Most people think they're brushing long enough when they're really not, and underestimating can cost you in the long run. And never skip brushing at night. No exceptions. Even if you're tired, even if your teeth look fine, that plaque hiding between your teeth is where harmful bacteria thrive. If you wear dentures, that's not an excuse to neglect your oral care. Bacteria can still build up underneath them too. And don't skip dental checkups. Sure, the dentist's office may not be your favorite place, but they're not just looking for cavities. Dentists are trained to spot early signs of more serious problems, things you might not notice yourself. If you've seen any bleeding when you brush, tenderness, or swelling in your gums, don't brush it off as just getting older. That's your body talking to you. And after all these years, you've learned. When your body speaks, it's worth listening. You deserve to age with dignity, strength, and peace of mind. Don't let something as simple as a toothbrush stand in the way of that. Take action today, not out of fear, but out of respect for the life you've built and the years ahead. Mistake 2. Infrequent bathing and skincare. How often are you really bathing? It's not a glamorous question, but it's one worth asking, especially as we get older. Many people start bathing less as they age. Maybe energy levels are lower, maybe we're not going out as much, or maybe the thought of stepping into a cold bathroom just doesn't feel worth it. But beneath that comfort-driven logic lies a more serious issue: your skin. It's the largest organ in your body, and just like your heart or lungs, it reflects what's going on inside. Dermatologists at the Mayo Clinic have found that changes in your skin can be one of the earliest signs of internal health problems, like diabetes, liver issues, or heart disease. And here's the thing: many undiagnosed medical issues in older adults could have been caught sooner if regular bathing and basic skin checks had been part of the routine. This isn't about being careless. Most of us don't neglect ourselves on purpose. We're just tired. We're doing our best to stay comfortable. And if no one's saying anything, we figure we must be doing okay. But that's the danger, isn't it? The slow slide into invisibility, the quiet forgetting of our own needs. No one knocks on your door to remind you to check your skin, to take a bath, to moisturize. So when something serious does show up, it feels like a betrayal, not by your body, but by the act of overlooking yourself. The fix is simple, but it takes intention. Start by bathing at least 3 times a week. You don't need expensive products or scalding hot water that dries you out. Use a mild, fragrance-free soap that helps preserve your skin's natural oils. After bathing, gently pat your skin dry, and while it's still a little damp, apply moisturizer. That locks in hydration and helps your skin stay soft and healthy. Don't stop there. Take a moment to check your skin, not with judgment, but with care. Notice any changes: discoloration, rough patches, itching that lingers, or dry areas that feel unusually thick. These aren't just cosmetic concerns, they're signals, and they deserve your attention. If anything feels off, mention it to your doctor. Don't wave it off or chalk it up to age. We've got to stop accepting discomfort as normal. You deserve to feel good in your skin. You deserve to be seen, heard, and cared for, including by yourself. So the next time you hesitate to take that bath, remember, your skin is trying to tell you something. Softly, clearly. You just have to be willing to listen. Mistake 3. Ignoring nail care. Take a moment to really look at your fingernails and toenails. Not just a quick glance. Really look. Are they clean, trimmed, smooth, and healthy looking? Or are they thick, brittle, yellowing, or flaking? It's easy to shrug this off as just part of aging, but here's the truth. Your nails are more than cosmetic. They're quiet indicators of your health. For many doctors, nails are one of the first things they check in older adults, because the body tends to whisper before it starts to scream. The American Academy of Dermatology emphasizes the importance of nail health, especially in seniors. Their research has shown that changes in the nails have led to the discovery of serious, previously undetected conditions in many cases. That's not just a statistic, it's a wake-up call. When your body begins struggling with something like your heart, liver, thyroid, or immune system, the signs often show up in your skin and nails first. Discoloration, thickening, splitting, or tiny dark lines under the nails can all point to something deeper going on. Take Beatrice, for example. She was 82 when she started noticing changes in her toenails. They were thickening, turning yellow, and making her shoes uncomfortable. She figured it was just age, another little inconvenience, and kept quiet. She wore socks more often, stopped going barefoot, and said nothing. But when the pain in her feet finally became too much to ignore, she visited a podiatrist. What looked like a simple fungal infection turned out to be something far more serious: a weakened immune system. Her toenails had been trying to tell her something, and the delay in listening cost her valuable time. Now, to be clear, the nail issue didn't cause the illness, but ignoring the symptom delayed the diagnosis. And that's what we need to talk about. Every time we dismiss something small, we risk missing something big. So what should you do? Keep your nails trimmed straight across with a slight curve at the edges to prevent painful ingrown nails. Make sure your feet stay clean and dry, and change your socks daily. Choose breathable shoes to reduce moisture and prevent fungus from growing. And most importantly, don't ignore changes. If your nails are getting thick, discolored, or pulling away from the nail bed, bring it up at your next doctor's visit. You matter. Your health matters, and your body is always speaking to you through your skin, your energy, your nails. The question is, are you listening? You deserve more than just comfort. You deserve clarity, care, and peace of mind in this season of life. And sometimes it starts by simply looking down, because the first signs are often right at your fingertips. Mistake 4: improper incontinence management. Did you know that more than 50% of adults over 65 experience some form of incontinence? Yet the majority never mention it to their doctors. It's one of the most underreported health issues in older adults and one of the most dangerous to ignore. Many go to great lengths to hide it, even from family, but silence doesn't stop the risks. It only increases them. As we age, our bodies change in ways we don't always expect. Incontinence might begin subtly, a small leak here, an urgent bathroom trip there, but without proper management, it can become a serious health issue. Urologists at Johns Hopkins warn that untreated incontinence can lead to chronic skin infections, increased risk of falls, delayed diagnosis of serious conditions like bladder or prostate cancer. In fact, seniors who address incontinence early have 60% fewer complications than those who try to manage it alone. So why do so many stay silent? Shame, embarrassment, a quiet fear of seeming weak or out of control. But what's rarely talked about is what that silence costs, not just physically, but emotionally. Living with incontinence in secret means changing clothes multiple times a day, carrying paper towels just in case, skipping events, turning down invitations, and eventually withdrawing from life. This retreat doesn't just limit your activities, it chips away at your confidence, your joy, and your independence. It happened to Douglas, a 73-year-old retired accountant from Arizona. He never told anyone about the leakage. He stayed home, wore extra layers, avoided long drives. But these solutions didn't prevent what came next: painful skin sores and a diagnosis of advanced prostate disease. Had he spoken up sooner, things could have been different. His pride nearly cost him everything. So what should you do? 1. Talk to your doctor. Incontinence is common, manageable, and often treatable. You are not alone. 2. Use proper protection. Don't rely on makeshift pads or paper towels. Use products designed for incontinence. They're more effective and more discreet. 3. Prioritize hygiene. Change promptly when wet. Clean gently and apply moisturizer to prevent irritation and sores. 4. Stay informed. Incontinence can be linked to other health conditions. Early treatment can make all the difference. And above all, don't assume incontinence is just a normal part of aging. It's not. It's a signal. Your body is trying to tell you something, and the sooner you listen, the better your outcome will be. You've spent a lifetime holding everything together through hard work, change, and sacrifice. Now it's time to show strength in a different way, by putting your health first, even when it's uncomfortable. There's no shame in seeking help. In fact, there's wisdom in it. Your dignity, your independence, and your joy, they're worth protecting. And it starts with paying attention to even the quietest signs. Would you like me to continue with Mistake 5 next?